So today I want to talk to an update from our last 24 hours, as we do, but also to talk about some of the areas of concern that we have in our communities right now. To start, we've had an additional 274 people diagnosed with COVID-19 in British Columbia, including one epidemiologically linked case, bringing our total number of people with COVID-19 to 12,331 in British Columbia. That includes 4,260 people in Vancouver Coastal Health, 6,720 sorry, I can't even read my writing, in Fraser Health, 249 people in Vancouver Island, 644 people in Interior Health, 365 people in Northern Health, and 88 people who generally reside outside of Canada. We have 1,920 active cases right now, of whom 71 are hospitalized, 24 of whom are in critical care or ICU. We thankfully have no new deaths to report today, but we do have 4,425 people under active public health monitoring and 10,114 people who are considered recovered. I do want to take a moment, however, to recognize the data was released yesterday from the coroner around the number of people in British Columbia who have died from overdoses. We had additional 127 people from our communities across British Columbia who died in the month of September. And my condolences and my thoughts and prayers are with their families and their communities, as we all know the incredible toll that both the pandemic and our overdose crisis have taken on our communities and on people who use drugs in this province. We have no new healthcare outbreaks to report at this time, and one of the outbreaks that we had at the Weinberg residence has now been declared over. That leaves us with 19 active outbreaks in our healthcare system, 17 in long-term care or assisted living, and 2 in acute care. Involving 950 residents, people, 546 residents, and 404 staff. There have been no new community outbreaks. However, yesterday we had our first school outbreak announced, and that is one of the issues that I want to talk to a little bit today. The identification of this outbreak came because of the work that we're doing with schools across the province to monitor and to contact trace anybody who has been exposed in our school system. And while it is obviously not what any of us want to see, it is not unexpected, as we know that COVID-19 is still circulating in our communities, and we know that that is reflected in what is happening in our school communities as well. Public health teams in Interior Health identified that there was unlinked transmission. Initially, there were 3 cases identified, and as of today, as the investigation continues, we're up to 5 cases that are related in the school community. And steps were taken by public health, working with the school, to ensure that they can contain the spread to the involved cohorts. And right now, that means 160 people in the school community are at home self-isolating, and the school is working with the families to make sure that ongoing educational needs can be met. And public health teams continue to be on-site working with the school community to continue the investigation and make sure that we have a full picture of who has potentially been exposed and who may develop symptoms in the coming weeks. And just a reminder that we are working very closely with the school community, and if you have not been contacted by public health to self-isolate, that you can continue to monitor yourself and go to school as you normally would. I do want to give a little bit of perspective. As you know, we've been reporting on all exposure events in schools since they returned to in-classroom learning on September 8th. And of the over 600,000 children and 35,000 teachers and staff involved, we have had a number of exposure events. We're now up to 213 in the somewhat 2,000, over 2,000 schools that we have. We've had 6 clusters, or where more than one person in the school has been identified, has been exposed within that school. And this is our first outbreak. So I think that helps us put it in the perspective that we are not seeing return to school causing amplification in our communities, but it does, as we've been expecting, reflect what is going on in our communities. The majority of the exposure events that we have had in schools that have not led to transmission to anyone else in that school community, and the majority of them have been in the Fraser Health and Vancouver Coastal Health regions, where of course we have the largest population of school children and the largest numbers of schools. So while it's concerning that we have an outbreak, what I think is positive about this is that we have been monitoring all of the exposure events, and we have had very little transmission in the schools, and public health has been working with the school community across the province to keep it that way. The other thing that is more concerning to us now is that social gatherings are where we are seeing significant transmission of COVID-19 in our province, and the impact is far-reaching. While contact tracing teams are working hard to contain the spread, we have seen that new cases stemming from social gatherings are spilling over to other locations, to other parts of our community. Social gatherings, especially recently, weddings and other celebrations, are proving to be high risk for all of us. Much of the recent surge that we have seen in cases in BC in the last couple of weeks is directly linked to social events. These events have caused clusters and outbreaks that have now spilled over into our healthcare system. So people who may have been at an event or a healthcare worker working at a long-term care facility and workplaces. We have seen now several large workplace clusters as well, and in our schools. And while many of these cases are concentrated in the Lower Mainland, the cases connected to events have spread right across this province. People who have come to an event that might be in the Lower Mainland have returned home. And the contact tracing, we have seen that people are not sticking with their COVID-19 safety plans for social gatherings, particularly ones like weddings and funerals. And that is a challenge that we all have right now. We may have the best intentions to keep them small, to make sure that we aren't having buffets, that there's individual servings, that people are keeping their physical and social distance. But it is hard, and right now it is not working for many reasons. We all, as social creatures, need to come together. We want to be with the people we love for these celebrations, and it is very hard to keep to those important limits that help prevent transmission of this virus. People are also coming together, and some cases traveling from other parts of the province or from other provinces, and they bring those risks with them. And when they leave, others are taking those risks home with them. And we have seen this now spill over into other parts of our communities. We saw this same phenomenon occur with house parties and vacation rentals this summer, particularly in the interior. And now we're seeing it with these family celebrations at people's homes and elsewhere. And I do want to say, that for the most part, people in our province have done the right thing and are continuing to do the right thing. They've listened, we followed public health restrictions, and I want to thank people for that, because we know that it is incredibly important, and it is the reason that we have been able to open up as much as we have and keep our economy and our communities functioning. However, as much as I am hesitant to do so, and we've seen this before, if there is a major source of transmission, additional measures can and will be put in place if they're needed. We will use all the tools that are available, whether that is conditions tied to wedding licenses, restrictions on numbers in indoor gatherings, or other measures that we know will be effective in trying to break these large transmission events. The reality is that right now in BC, everywhere in BC, weddings, funerals, and other life occasions need to be small as possible. Every gathering needs to be our own household only, and at maximum, our safe 6. We need to put in place those same thinking that we did in the summer when we saw surges in vacation rentals and parties that were happening. to all of our social gatherings. This is a critical time as we're heading into our influenza season, as we are focusing on the priorities in our communities of keeping our businesses, our schools open for the health and well-being of all of our communities. Now is a time where we need to control and manage our social gatherings to keep this virus in check and prevent it from spreading to those in our family and our community who are going to be most affected by it. This may mean a civil ceremony now for people who are looking at getting married with a very small number of people, and save that important celebration and party to next year when it is safe for us to do that with those family and loved ones that we care about. As hosts of the celebrations, I ask you not to invite others to your gathering right now, and not take offense if people choose not to come because they are concerned about their own safety or about the risk that they may be bringing with them. Show you care by keeping those outside your immediate household off your invite list right now. Sometimes it's very challenging for people to say no because we want to be supportive, we want to be together with our families. But it is not safe for everybody right now, and we need to recognize that and accept that in the people in our lives, in our communities. As a guest, support your loved ones by choosing not to attend and by showing your support in other ways. The risk is too high for all of us, and we have seen that in other jurisdictions, both here in Canada, in the United States, and around the world, that this virus can get out of control very quickly, but we can do our part to have those safe celebrations in a small way and save those larger celebrations and memorials for a time when it is safe. You may think the risk also doesn't apply to you because you live far away from the Lower Mainland, or you are very healthy right now and you don't have those same concerns. But we have seen on many occasions, and again we have seen this week, that COVID-19 knows no boundaries and impacts us all. This virus affects people, and when people move, we take our risk with us. And we have seen that spread to all parts of this province, and we've seen it spread from other provinces here, and we take that home with us. We've also seen spread in businesses, and we know that people have done a lot of work to make sure it is safe for restaurants, for office, for retail outlets, for any type of business to have their COVID safety plan. But now is the time to revisit the workplace safety plans that you have put in place. We have seen transmission in lunchrooms, in carpools, with workplace social interactions, and in the workplace itself. There will be an increased inspections by WorkSafe BC in the coming weeks and days, and by our environmental health teams, and enhanced enforcement across the province to try and address some of these issues so that we can maintain and continue to break those chains of transmission. So make sure you and your employees are doing what we need to keep everybody safe. We all have a role to play, and we know that here in BC, and we have done our part. We need to continue on this road together, and we all need to continue to take those measures which protect those who are closest to us, and to protect our communities, and to protect those we don't know. What you do impacts everyone around you, and what you do makes a difference. So I am appealing to us all. We need to continue to do our part together, to stand together by staying apart, and we need to do that every day. And please, we need to do this as well by being kind to each other, remaining calm even though we may have concerns about what is happening around this virus and around our communities, because that is how we will continue to keep each other safe.